at Pittsburgh Emergency Medical Services, and he's going to speak for us. Thank you, Simon.
Thank you. I'm a little out of sorts not having a podium. I might wander around a little bit, and usually have something to keep myself grounded. But thank you for the opportunity to be here. As I was so kindly introduced, my name is Simon Taxel. I'm a crew chief of the Pittsburgh Bureau of EMS. I'm also a fellow of the Bloomberg American Health Initiative at Johns Hopkins University, and I'm nearly done with an MPH there. So by the end of this year, we'll be complete with that. The focus of my work there is addiction and overdose. I do a lot of work here in the community in that space as well. But first, before I really get started, at this sort of event, and as we try and understand the complexities of public health problems like hepatitis C, we talk a lot about structural racism, inequality, systemic racism, the social determinants of health, and speaking truth to power. So the first thing that I want to do is acknowledge the privilege that comes with being a white man like I am and getting a platform to speak at events like this freely and frequently, probably at a level that is beyond my scholarship and beyond my contribution to the work. So the first thing I wanted to do is say that if there's anyone out here that does not receive that platform and has something to add and something important to say, I'd like to cede my time here at the microphone and offer my space to you. So if there's anyone here that doesn't have that opportunity, that would like it, feel free to come up. Well, I guess I might have some interesting things to say. So, as Julia Prevention Point and the CDC say, hepatitis C in the United States and here in Allegheny County is mostly driven by injection drug use. I'm going to quite respectfully say that's not necessarily true. It is driven by the conditions of drug use. In healthcare, we provide medication by injection day in and day out on almost every single shift that I work. And we have reduced the transmission of bloodborne pathogens in the healthcare environment to a nearly undetectable level. And we do that through using sterile supplies and aseptic technique. And so I say emphatically, the transmission of communicable diseases is a result of the conditions of drug use. And those conditions are a policy choice. Those conditions are what we choose. And it starts with prohibition, criminalization, and the war on drugs. And I use that phrase, the war on drugs, because that's what it's commonly understood, but the fact is that's a war on people. And the overwhelming majority of those people are black people. And so we make this war on people. We have drugs illegal and criminalized, which creates a toxic and dangerous supply and pushes its use out of the light and into the dark corners of our society, in alleys and on street corners. But that is what we choose. It is not inevitable. And we can choose to be better and to do better. And as I talk about structural racism and systemic inequality, it's important to remember that here in Allegheny County, the age-adjusted death rate for hepatitis is 4.7 times higher for black people than it is for white people. So these issues come to bear directly on what we're here today to talk about. So we can do better. We can choose better policies. There is a whole myriad of evidence-based solutions where we can bring the transmission of hepatitis C in this community down to nearly zero. Prevention Point is doing incredibly important work, but we need more SRIM services. And Julia is the only one in the entire county that can't be everywhere they need to be. We need harm reduction or public health vending machines. There are vending machines that are put at key locations where people can access sterile supplies, sexual health products, naloxone, fentanyl test strips, all those items that they need to keep themselves safe autonomously on their own time in their own community. We can do that. It's not particularly expensive, and it can make a huge difference. We need safe consumption spaces. We need spaces where people can use drugs however they see fit and have access to resources for recovery when they're ready, should they choose to access them, where if an overdose occurs, it can be reversed without having to engage with, unfortunately, EMS providers like myself and the police and the healthcare system more broadly. And then there's a ton more that we can be doing in the EMS space. And I'm speaking here from my own position. I'm not speaking for the municipal government of the city of Pittsburgh or the administration of Pittsburgh EMS. But we could be doing syringe services out of the back of the ambulance. We were the first EMS agency in Pennsylvania to do leave behind naloxone at the site of an overdose. We were one of the first to provide fentanyl test strips. We were the third EMS agency in the entire country to do field EMS induction of buprenorphine. I'm actually the second paramedic ever in the Commonwealth of Pennsylvania to give someone buprenorphine on the side of the road in the back of an ambulance. And what I'm saying is that we've done some, but it is not nearly enough. We have a foundation of harm reduction, but we can do more. And as I wrap up, I guess what I've learned in 20 years of doing this work is that no matter how many lives I save or what I do at the bedside, reversing overdoses, providing care, the real changes that save lives at the community level, that saves lives across the population, occur at the halls of the legislature, not at the bedside. And so we advocate, we can provide little stopgap measures, but it really falls upon the policymakers, the legislators, the leaders to choose better policy. We need to end the war on drugs, the war on black people in the United States. We need to end drug prohibition that creates the conditions of drug use that lead to the transmission of infectious diseases and a myriad of other health problems throughout our communities. These are policy choices that we can demand as a community that our legislators and leaders can provide. They are evidence-based and they are out there. So, as I finally wrap up, we can do better, we must do better, and we can choose better policies that will end the spread of diseases like hepatitis C throughout our communities. Thank you for the time and the opportunity to speak here.
All right.